any further ado, we are going to welcome our presenters this evening. Tonight we have Janet Chupka with our policy and advocacy team and the first project in review. Very excited to hear the results of their research. And I'd like to take a moment to thank our sponsors for our virtual symposium 2021. We thank you so much for continuing to support our community. And now I will hand it over to Janet.
So thanks everyone and welcome in. As Jeanette said, this is the first project in review. And first, for those of you who don't know, stands for Females in Research, Sharing, and Translation. My name again is Janet Chupka and I'm part of the public health team here at HFA. I am your presenter for the evening and I'll be joined a little bit later on by my colleague Mabel Crescioni, and then three wonderful ladies, Amina Iftikhar, Candice Lerman, and Julia Conde will be joining us for a roundtable discussion. So I'm really excited to share with you about the work that we completed in the first project. But before I do, I just want to provide a little bit of background and share with you how the idea for the first project came about. So we had a previously funded Patient-Centered Outcomes Research Institute, or PCORI award, that enabled HFA to train and educate the community about patient-centered outcomes research and comparative effectiveness research. And we learned from this project that while we see medical advances occurring in the community as a whole, and we've heard a lot about that this week already in some of the symposium sessions, women were reporting being underrepresented in these research endeavors. But despite this, a large number of women indicated that they'd be interested in engaging in research if they were just given the opportunity. So you all showed up. We women comprised over 50% of the attendees to our Pride Project presentations, and we listened. So we outlined the first project, and we were awarded funding from PCORI to move forward with the project. And patient-centered outcomes research is truly centered around the patient. And in this project, we focused on the women of our community. This patient-centered approach allows women to be engaged throughout the entire process of research, from the development of the study to the reporting of information back to the community and other stakeholders. So the objectives, we created this project with the goal of gaining a better understanding of the current levels of research engagement and to identify gaps in participation in research for females in the bleeding disorder community. The long-term objective really was to increase female influence and engagement in research development, implementation, and dissemination of results, which ultimately affects clinical care for females with bleeding disorders and potentially other rare disease states. So the work in the project was completed over 2 years. And the first year consisted of just traveling around the country and listening to women, getting their input during focus group sessions. We really wanted to understand their experience and participation, or as we learned, lack of participation in research opportunities, and then what factors would help them to participate if they were given the opportunities. We kind of then turned the tables and spoke to community stakeholders through semi-structured phone interviews to gain their experience, including women in research, and ways that they thought could facilitate the inclusion of women in research studies. So we did that. We analyzed and summarized the results of year one's work, and then that brought us into year two, where we formed a community-based research network. And this network allowed us to bring the women from the community and then other community stakeholders together to discuss priority areas of need for women and kind of outline a real high level research agenda. And our hope and plan is that our next steps can be to convene a steering committee of community members and stakeholders to further refine this agenda and then broadly disseminate it. in the hopes of identifying some stakeholders who are interested and willing to fund a project or even multiple projects. So our year one focus groups were made up of participants from the following HFA member organizations. So our member org in Puerto Rico, Sangre de Oro in Albuquerque, New Mexico. We met with the women at HACA in Arlington, Virginia, the Virginia Hemophilia Association in Williamsburg, Virginia. And then our fifth and final focus group session was held virtually over Zoom due to the pandemic. But we had 4 women who participated in that session, and I would be remiss if I didn't mention these groups and thank them and thank the women who provided such valuable information to our project. Likewise, the semi-structured interviews with the stakeholders, these folks really helped us out and provided a lot of great information about what they're doing and how we can better include women. And so these folks, there was a hematologist from Atlanta, Georgia, who participated, a hematologist from Boston, a lead health scientist from the CDC in Atlanta, an executive director of a bleeding disorder focused nonprofit from New Jersey. We had a certified genetic counselor from Wisconsin, and then a patient advocate of a biotech company in California. And I also want to thank them for their time and willingness to share with our team in support of the women in our community. So moving on to what we learned from the work in year one, when asked if they had ever participated in research or clinical trials, almost all of the women from the focus group said that they had not. There were kind of a variety of reasons women gave for the lack of participation in research, and some of them I have listed on the screen. So burden of participation, that included things like financial reasons, such as cost to travel to studies, parking, the loss of hours of work or school, family issues, so having to be away from family or finding childcare so that they could attend appointments. And then lack of available studies was another reason given. The women felt that the studies that are available focus on men and children, and that the parameters that are set from the outcome automatically exclude women who don't have a diagnosis. And we know that's a problem. And then finally, lack of trust between patient and provider. And this barrier was brought up in every single focus group that we did. And the women who participated described feeling like they are just not being heard by their providers, or the symptoms that they have aren't being taken seriously, and that prevents their providers from informing them of research opportunities because they just don't feel like they'd qualify. So overall, women expressed many concerns and barriers for participating in bleeding disorders research, but the barriers didn't indicate an unwillingness on behalf of the women to participate. They're very willing. They just found that these to be issues for them to do that. So on the flip side, some of the ideas that women shared that would motivate them to participate, one was to leave a legacy for future generations. Women shared that their motivation to participate focused largely on the ability to contribute to novel research that may improve the quality of life for other women with bleeding disorders. And they felt a sense of responsibility and stated that the ability to help their daughters and possibly even their granddaughters or future women with bleeding disorders would really motivate them to get involved. Some women preferred more tangible motivators, such as monetary compensation, again, to make up for that missed time at work or school and money for travel. Improve communications, more specifically, improving the relationship between researcher and participant. Women really want researchers and providers to listen more, respect them, and to realize that they are as important as males. Other suggestions were around logistics and included having the research take place at convenient locations, such as hemophilia treatment centers or even at events where women are likely to be attending, such as HFA's annual symposium. And then free childcare was mentioned, expanding the requirements to include women who are older than 35. Another suggestion was to be more inclusive of research for racial minorities and those who speak languages other than English. And then they offered some ideas for recruitment strategies, which included posting flyers in providers' offices, targeting mothers of boys who've been diagnosed with bleeding disorders. And then they stated that they felt it was really important to have the results of the studies disseminated back to the study participants to show impact and then encourage future participation. So what about from the stakeholder side? Most of the stakeholders said that they have worked with women in the bleeding disorders community in clinical research or education, but we're really concerned with the lack of engagement of women in research. Some of the reasons that the stakeholders feel that women are not engaged were that there's not enough medical evidence to understand the differences between men and women with bleeding disorders. There's a lack of diagnosis in women, the impact of or on quality of life. So maybe if they had to miss a dose of factor to be in a study, that would really have a major impact on their quality of life. They felt that possibly the stigma that's associated with bleeding disorders in women might be a barrier. We know that oncology funding takes precedence, and then just an overall clinician's lack of interest in women's research. Some of the ideas shared by the stakeholders for ways that these barriers could be overcome were to increase education for providers, increase advocacy, of course, increase funding for research with women, for women with bleeding disorders, increase communication about research opportunities, unconscious bias training, and then generating data and better disseminating that data to scientific and general audiences. So in summary, for the work of year one, both the women and community stakeholders had a strong interest in working together to expand the number and types of research studies about and focused on women's issues, but the lack of opportunities and or the awareness to do so. The support, again, needed for participation would be things like economic compensation, providing opportunities for women that are outside of regular clinic hours, clear communication, so a real good understanding and outline of dates, times, and the commitment that will be required to participate, and then childcare. So, you know, to keep these things in mind when research studies are developed. So the next step happened in year two of the project. We brought a group of patients and stakeholders together to form a community-based research network, and it was a lot of fun. And we were just, you know, started the conversations about the real issues that women with bleeding disorders face, and to begin outlining research priorities in a formal documented research agenda. We created an application for both patients and another one for other stakeholders. And through this application process, we selected 4 patients, 3 hematologists, 1 OBGYN, and 1 representative from another bleeding disorder community organization. We created some materials, which included a workbook, and then utilized PCORI's online research fundamentals training to have this group work through and really kind of get them comfortable with the research process and the language utilized. We really wanted everybody in this network to feel comfortable with the work that we were trying to do and the language that they would be hearing. We had 5 virtual meetings. We met once a month for 5 months, and each meeting started with a patient story to kind of just ground the group and remind everybody why we were getting together and the work that we were trying to do. So we did develop this high level document research agenda, And our hope is that, at least some of the people that were involved in this network will stay involved in the future refinement of this document, and then the broad dissemination to a wider group of stakeholders. We did plan a capstone event for this project, and our hope was that we were going to have this session in person this year, and we were going to bring this group all in to speak about their experience at this symposium session. But because we were all virtual, we sort of pivoted and created a video with all of the participants to share their experiences and some of the outcomes of the work. And this video will be available. We are outlining a whole page that will be available probably shortly after symposium on the HFA website, and you'll be able to view the video in its entirety on that page at that time. So be watching for that. But I just really wanted to give you a sample of the work that we created in this video, and to hear from some of the group that participated. And then following the video, we'll shortly after that, we'll roll into the roundtable discussion, and you'll get to hear from the patients themselves. So Jeanette, if you want to start the video, I will stop sharing my screen.
No, I never thought I was going to see the day where research was going to be done about women with hemophilia.
It finally feels like people are really listening and they're starting to move forward and not just sitting in one spot talking.
I had to do something. When I saw the opportunity, I was like, this is a great way to kind of start making those changes that we need.
We had a lot of opportunity to hear anecdotal evidence that told us that, the women in our community were struggling with access to care, with access to medications, and even that clinicians in delivering care didn't have enough evidence to be able to make recommendations about care, or to even provide the care that the women were seeking, because the evidence wasn't necessarily out there to support treatment plans. And so we, based on hearing all of this evidence, all these anecdotes, we realized that we wanted to be able to collect some data in a systematic way, and to be able to show that there was a need to create this project where we worked with researchers and academic researchers to bring to light the issues that women with bleeding disorders feeling.
So we wrote a proposal for our first project, which stands for Females in Research, Sharing, and Translation. And we were awarded that the opportunity to move forward with that project from PCORI as well. And really the goal that we came up with for this project was to increase female influence and engagement in research development. So implementation, idea generation, all the way through to dissemination, which we're hoping will ultimately affect clinical care for women with bleeding disorders. We went out into the community first of all, and did focus groups with women that have diagnosed bleeding disorders, or women that have bleeding symptoms who may be yet undiagnosed, and listen to them, ask questions about if they are participating in research, what kind of opportunities exist, and then what are some of the barriers to participating in research. Did the same thing with other community stakeholders, so researchers, providers, other community organizations, and ask those stakeholders similar questions. Are they engaging women in research? If so, how? If not, why? What are the barriers that they were encountering? And kind of, use those themes from both of those stakeholder groups, and to kind of come together to bring those two groups together and start conversation. Next step, our second aim was to create a community-based research network. And so we did just that. We brought a group of of community stakeholders and the patients, and then other stakeholders together, and worked in this community-based research network to hash out kind of the topics that are really relevant for patients, and then outline a research agenda.
There's not been that much research done in women with bleeding disorders. And there's still so many unknowns out there as to the effect that the bleeding in women has as we age, as well as just typical, ways to impact everyday life for women with bleeding disorders. So many women are affected, especially with their monthly cycle, and just lose days and days of either work or school because there's not really a gold standard for treating women with bleeding disorders.
Our community has spent a lot of time focused on research, predominantly in males with bleeding disorders, and appropriately so. That's the origin of all of this, the hemophilia treatment centers. But I think over the last few decades, I think we've started to recognize that women and girls need to have some research focus as well. And I think more recently, we start to see a lot of patients come forward, tell their stories about their bleeding journeys. And I think this is a culmination of a lot of those stories. And I think it's one of the first sort of steps in the right direction to sort of create a roadmap, outline the needs, the unmet needs of this community.
Women with bleeding disorders just face a lot of trouble within the medical system at all levels, mostly because there's just a lack of understanding and research into how bleeding disorders truly affect us, and in all facets, right? I mean, most common thing would be at hemophilia treatment centers or at a gynecologist's office, but it really comes down to too, like, if I go to the dentist and I have to tell them I have a bleeding disorder, like, they kind of look at me like I'm crazy.
It's very apparent that and we know that we need a lot more research in this area from an education, advocacy standpoint, as well as actually just improve clinical care and outcomes. So it's exciting to see a real push to address some of these unanswered questions.
I was diagnosed just about 6 years ago and realized real quick that women weren't getting acknowledged, and even if they were lucky enough to get a diagnosis, they weren't getting proper treatment. Just through my diagnosis, I found a voice that I didn't know I had, and I've just been so blessed to get to know so many people and to help women. So when I was asked to join this, it was like, yes, I get to see some of the doctors that are working on this type of stuff, and I get to share my story and share stories that other women are constantly calling me and telling me about.
This whole project is focusing on females, and there is not such a big research on the females at all. So that was the best part for me to participate in this, that they are focusing on us, and finally we are going to have our share on the table too.
I thought it was a great opportunity to learn a little bit more about research from a different perspective, and to kind of shift the lens of how we ask questions as researchers, to be more patient-focused and patient-centered, and to hear some of the patients' experiences with research and kind of the questions or outcomes that were most important to them, and to help with the project for the HFA, but also to help inform my own research and my own efforts to think about how do we incorporate the patient voice into what we're doing.
So I don't want to take up too much more of your time, but I do just want to show you one last little sneak peek. The table on the right is kind of a sneak peek of the research agenda that we worked on together, and the column on the left states some of the priority themes that were identified by the group. And again, I just want to state how much I enjoyed working with this group, and how positive everybody was. And I think we really have a great start to this research agenda and look forward to taking it to the next steps. So it is now my distinct pleasure to introduce to you our roundtable panel, which will be led by my colleague, Mabel Crescioni. So Mabel, I'll let you take it from here.
First of all, thank you, Jenna, for the presentation, and sort of going back to the last slide there. I think one of the things that we tried really hard during the process of thinking about this was to try to look at women's spectrum of life and look at different research questions at different points of time. So, you know, from childhood, adolescence, through those childbearing years, and as we enter menopause and older age. And so it was really important that we look at that that whole experience, and that we try to think of what were some of the most important research questions within that life span of a woman with a bleeding disorder. So my role now is to facilitate a conversation with these fantastic participants that we had in our community-based research network. So I'm going to ask Amina, Candice, and Julia to come on video so that we can have a discussion. So Candice was one of our participants in the CVRN, as well as Amina and as well as Julia. All three of them participated in the meetings that we held along with researchers and along with some other stakeholders in the community. And so what we're gonna do now is to I have a few questions that I'm gonna ask of you. I want this to be a conversation. So, you know, I may ask Amina a question, but Candice and Julia, if you wanna follow up with something, feel free to do that. It's just, you know, sort of a way for us to share the experience of what FIRST was like with the rest of our community. So maybe each of you can talk a little bit about how you became connected with HFA and with the women's programs, and then why did you choose to participate in FIRST?
I will go first, if you don't mind. My local chapter, which by the way is also, got me in contact with the people in charge of this project, and I was so happy. I mean, it's unbelievable that we are, I was going to mention that a few weeks before the program started, I was in another program where I hear that probably we weren't going to start researching hemophilia in women for the next 10 years. So I was losing hope. I was like, oh my God, another 10 years waiting. And 3 weeks later, to be part of this program where we were looking for solutions, where we were connected with the doctors in the community. It was a dream come true. It brought hope to our lives. Well, I can say that for myself. I have hope. I am more aware. I don't feel isolated. I know that we are all in this together, that there are many women out there that are looking for the same kind of validity, support, research, treatment. So that's how I became in contact with this program, and it has been a wonderful thing. So thank you for letting me participate in it.
Thank you, Julia. Candice or Amina?
So I ended up finding HFA when I went on a wild goose chase, because I don't actually have hemophilia. I have immune thrombocytopenia, or ITP. And the research into my rare bleeding disorder is extremely limited, and anything involving women is pretty much non-existent. So I was recommended to check out HFA and connect with the Blood Sisterhood and start to connect with other women with bleeding disorders and try to understand a little bit more about the challenges of family planning and looking at the future. And so I stumbled across the Community-Based Research Network project and reached out, and it's been an amazing journey ever since.
So my name is Amina. So Julia and Candice sum up everything. I heard about him, HFA a lot, and I attended a couple of their conferences, and I know how amazing what they were doing. And when this opportunity came up, I was like, somebody has to do something. So I become part, and I just enjoy each and every bit of that group. All these amazing ladies I met there, you know, we get to hear what medical provider side is regarding female disorder. So it was just amazing. And I'm really glad that I became part of this group.
Great. So I'm going to turn the first question over to you, Amina. What did you think of the process of coming together to develop a research agenda about women with bleeding disorders? And what did you feel you were able to contribute to that process? And what did you gain from it?
So first of all, I was really glad that somebody's doing something for us. We are not the invisible side of hemophilia anymore or bleeding disorder anymore. So that was the first thing. I was just so excited that, yes, I become the part of this thing that, they are taking initiative and I'm becoming part of that. So excitement was first thing. I learned a lot from the medical providers. They were part of this group. And learning from other females, their stories, it was just amazing experience overall. What I contributed very little bit. But my participation, my story, my side, how we are ignored for so many years. And, I could see that there is something at the end of the tunnel now.
And what do you think you gained from it?
Oh, I gained, I gained the spot now. I'm part of this amazing research that we are doing. And that is the biggest thing, I feel I brag that, I'm part of this research. So that's the main thing I guess I gain.
Thank you. Candice or Julia, either one of you want to answer the question?
I am with Amina here that I felt that my contribution was little, it was my story, but what makes the difference is that it wasn't only my story. And the providers, the doctors in the community were able to hear many of us talking at the same time. And it's not the same when one woman come and say, these are my symptoms, this is what is happening to me, than when a group of women get together, get together and we come together and say, yeah, this is not me, it's us. And we are all requesting attention because we are having the same symptoms and the same issues and we need help. So yeah, our voice was stronger together. And so the contribution I felt was little, but it was part of something bigger. And what I gained hope, I gain knowledge. I cannot believe that after so many years in the community, there was so many things I didn't know. So I gain knowledge, I gain hope, and I have a very strong purpose about keep on going and moving forward and not letting this an isolated thing, but hoping to continue and to make it something bigger.
Thank you, Julia. Okay, so we'll go to the next question, and I'm gonna direct this one to Candice. So of the things that you learned as part of the CBRN, what surprised you the most?
I would say it was the acknowledgement from the physician participants that there really is this research hole for women and through their patient journey through life, through adolescence, coming into puberty, becoming a woman, childbirth, menopause, and that absent the institutional knowledge they pick up in treating patients like us, there isn't anything official. So if you walk into a doctor's office or walk outside of a hemophilia treatment center or perhaps just a hematologist's office, there really isn't anything there for anybody to look up and to kind of understand what women like us are going through, which was alarming. Alarming because when you're going to somebody's physician practice, regardless if it's a dermatologist, a dentist, or anybody else outside of treating the blood disorder itself, they don't have a frame of reference to understand what our concerns are or how our bleeding disorders can impact treatment outside of just directly the issue of clotting or excessive bleeding. So for me, hearing that, it sort of confirmed that, yes, the struggles I've had just in regular everyday life and seeking preventative care doesn't mean that I'm crazy. It really does mean that we have to do something about driving the research, getting it published, and getting it into the hands of physicians, regardless of their specialty, so that when we're going to the doctor or we're just, going through the motions of preventative care, that they have an idea of how to work with us and also to just enhance our quality of life.
Thank you. Um, so I guess the other question, and Julia, I'll pose this one to you. So are you able to relate to the research priorities that we identified? So if you think about the agenda and the document we created and all the questions that we came up with, can you relate to the topics that were selected and put on the agenda? And if so, are you willing to share with us how can you relate and why?
Absolutely. Well, like many other women, we are living busy lives. But if we get the if we get the accessibility to be part of the research, and so that we can contribute without being in our detriment or, economy, taking care of the house or things, I believe that that it will be easier for many women to participate in research like this one. So I agree with that. The topics that we chose, I mean, they were amazing. Part of the awareness that I gained with through this project was, before joining it, I think that I was perhaps thinking of me, of my issues, of what I was going through at my age. And I realized that there are other topics that are as important, like prevention, early diagnosis. I mean, the life of many other young women will be improved if we start to diagnosing them early and give them the proper treatment at that age. So perhaps I began to be more conscious of other needs in the community that didn't have to be with my own. And so the topics were great, and the issues that were raised and the obstacles that were mentioned. And that's great, because if we know what the obstacles are, we can work together to try to, to overcome them and make it easier for other women to participate in this kind of research.
Thank you, Julia. Amina, Candice, do you guys want to add anything else?
I guess Julia summed it up so well, but I'm sure that we are the last generation who are undiagnosed. And next generations are going to get not only diagnosed, but the whole treatment as well. And, we need to just not stop here now. We need to do it more. So, people just don't ignore us anymore. And I guess that's something you all needed. All the women needed that in the hemophilia or bleeding disorder community.
Definitely. Thank you. Candice, did you want to add anything?
I'd say probably the coolest thing about this is that, like, in my professional life, I work in the pharmaceutical industry. And so being a part of this and seeing the research, it made me go back and think about how we approach the patient journey in drug development. And it made me realize that as ladies, we're not really included in that. And no one is actually thinking about our unique journeys and the stuff that impacts us as women. And so it's just a generic patient journey, and generally it's around men. And so our needs aren't being addressed, and it doesn't help the physicians who are fighting hard to take care of us. So it made me really rethink what the future holds, not only for just healthcare delivery, but also treatments for us as ladies as well. Because I do recall a conversation where we were discussing gene therapy, and right now gene therapy is only available for men, and it's only available for men because men are considered the severe hemophiliacs. And it's like, but wait a minute. How do you know, like, just because it manifests itself in a man a certain way, how do we know that women aren't severe too? And is it just a disparity in understanding how these bleeding disorders present in men versus women? And I think it was just a really great opportunity for all of us to sit there and sort of get out all of our thoughts and have those stakeholders, have the doctors there to confirm our thoughts, answer our questions, and sort of guide the discussion along in a way where we were able to create this really awesome guide that hopefully will continue for the next several years to drive the research we need to live a better life.
Thank you, Candice. So I guess the final question I'll ask is, what do you hope comes out of this? And you've sort of touched on it a little bit throughout the conversation, but if there is, one thing that you would like to see happen out of the work that is listed in the agenda. It could be a specific research question, or it could be something more general. Would you like to share with us what that would be? And now I'll open that up to whoever wants to answer.
Well, my hope is that like Candace said, that the research will continue, that it won't stay here. We work so hard, really, and we open our hearts, and I hope that this is the beginning of something. I have been thinking to myself, if perhaps that's how men felt when they started research, and the pharmaceutical companies started researching and bringing to the market medications for them. I hope that we will have early diagnosis in girls, in teens, and that we will have a better treatment, more understanding, and more respect and validity for women with bleeding disorders. I am not hysterical. I have something. I feel it. I cannot move my joints. So with this research, I hope that it will open the door to many more possibilities to better our lives in the community.
Thank you, Julia.
I can go second. I second each and everything that Julia said. It just shouldn't end here. There should, it should keep on continuing. And we as a women, we need to advocate ourselves too. So or more research could happen, and more participation. People should participate more. So that's what I want to see more.
Definitely. Thank you. Candice, do you want to say anything else?
I'll just call out my industry on this. I hope that this project kind of, makes a couple people perk up and say, oh, geez, how as the pharmaceutical industry, who finances and funds a lot of research, donates to HFA and supports the programs, how can we get more involved? It's to pay attention to projects like this, pay attention to the questions that we're asking and we're posing, support the funding and the initiatives, and also go back and look at the delivery of your products that are on the market and think about what is the messaging and marketing to women, especially if your product is designed to help us. Think about the questions we have. Think about our journey through life from adolescence all the way through menopause, and how your educational materials could support us. Because that was one thing that we all talked about, was that our sons, our brothers, our uncles, our dads, our grandfathers have great information and seem to go through things pretty easily, but there's a knowledge gap and an information gap for us, and we need this information too, but we're also here to help you create it.
Thank you, Candice. So now we wanted to leave a few minutes in case our audience wanted to ask questions. So I'm gonna ask Jeanette to let us know if there's any questions that have come in through the chat that we want, or if you have a question and you want to put it on the Q&A, please do so. If you'd like to ask a question of any of our participants or of Janet or myself, we are happy to take questions.
I will say there were a few questions that came in that we were able to answer while we were listening to all of you conversate. While we're waiting just to see if anyone else has a question they want to throw into the chat or to the Q&A, I'll make some reminders. First of all, if you have not been to our HFA exhibit hall to see all the sponsor booths, please be sure to visit there. And if you want to continue this conversation throughout the week, later today and throughout the week, you can visit us on our Slack channel, #network-blood sisters. And you can connect with us there to talk about other women's issues. We'd love to hear your questions and get you some answers and start some good conversations. And then finally, I do want to remind all the women who are on this call that our upcoming Sister Space virtual event is coming up. We are absolutely out of craft supplies, but you are welcome to still register and join. We'd love to have you be part of the Blood Sisterhood at that time. I don't see any more questions in the chat at this moment. unless I'm missing
I did want to add one final thing.
Go
If
ahead.
you want to know more about the first project, feel free to visit the HFA website, and there's more information about the project, and the full video, if you'd like to watch it, is also available there. And if you have questions about the project, feel free to contact Janet or myself, and we'd be happy to answer any questions. And most importantly, we are crossing our fingers that we're going to have additional support to be able to refine this agenda, like Janet said earlier. And so this is not the end. It's a stopping point and a starting point upcoming. And so stay tuned, because we're hopeful that we will be able to continue this work and refine this and get more stakeholder buy-in.
Wonderful. I do see that our tech support Heather has put the first project link in the chat as well. Thank you for that, Heather. I do want to ask one more favor from all of you wonderful women on this panel. If you would please give our women a message of empowerment or encouragement as we leave this space tonight. Whoever would like to start.
Yes, don't be scared to come forward with your story. Your story is important, and even if you feel that it won't make a difference, it will. Perhaps it's one story, but like I say before, this is a group of women, so your story will be one more to present to the advocates, to the doctors, to the organizations that can help us, and it will really make a difference. So don't be scared. Come forward. They are beginning to listen. So we have to keep the movement.
Wonderful.
So I would say you are important. Don't forget that, and stand up for yourself. And if you are standing up for yourself, other people are going to stand up with you as well. So you are important.
And don't be afraid to make a lot of noise. Don't be afraid to question people. Don't be afraid to push your doctors. And it's one of the reasons why I'm able to do as well as I am, is because I've challenged doctors who didn't know my bleeding disorder, didn't understand the impact it had on my life. And I found doctors that were willing to work with me. And at the end of the day, you're the quarterback of your own healthcare team. And so you need to make sure that everybody's playing on your team and knows what you want to do and is willing to work with you.
You women are an inspiration to all of us. I can't thank you enough for this important work that you're doing, beginning this global conversation that we all need to keep having. I especially appreciate it myself. So thank you all for your time and effort previously and today presenting this information to us, especially to our very own Janet and Mabel. Thank you for your work on this and to our research team for this important project. Like I said, you can continue this conversation in our Slack chat channel, Network-Blood Sisters. We look forward to chatting with you there. And we hope you all have a wonderful symposium. And we'll see you tomorrow for day 5. Thank you all for being here. Have a wonderful night.